Indianapolis, the 2020 Indiana gubernatorial debate, sponsored by the Indiana Debate Commission.
Good evening, and welcome to the second of two gubernatorial debates organized by the independent, nonpartisan Indiana Debate Commission. We are live in the studios at WFYI in downtown Indianapolis, and soon we will be hearing from three candidates on the ballot who want to be your governor. I'm your debate moderator for the evening. My name is Nadia Brown, and I'm an associate professor and university faculty scholar of political science and African American studies at Purdue University. Now, to introduce the candidates. They are incumbent Republican Governor Eric Holcomb, Democratic challenger Dr. Woody Myers, and Libertarian challenger Donald Rainwater. Candidates, thank you for joining us and giving voters an opportunity to hear from you. As you will notice, while we are here at WFYI, we are all in separate spaces due to safety concerns in light of COVID-19. Despite the separation, we look forward to having a robust discussion on the issues tonight. During the first debate, my colleague Andrew Downs asked the candidates about important issues facing Hoosiers. They discussed education, COVID-19, taxes, the environment, guns, and the fundamental role of government. The Debate Commission and I have selected tonight's questions from hundreds of ideas submitted by Hoosiers across the state. The topics have not been shared in advance with the candidates. The rules for our debate are simple. The candidates will be given 1 minute to make an opening statement, and then the questions will begin. Each candidate has 1 minute to respond to each question. Candidates may request an opportunity for a 30-second rebuttal by raising their hands. Candidates will answer questions in a rotating order that was predetermined by a drawing earlier this month. So let's begin with the opening statements. We'll be hearing from Governor Holcomb first. Governor, you have 1 minute to make an opening statement.
Thank you, Nadia, and good evening to everyone who is watching, hopefully again. Thank you for joining us. I hope you also express your voice by voting no later than November 3rd for all eligible voters, judging by the turnout already. Many of you already have. I've spent the last 4 years primarily focused on three key areas. One, putting people first. Two, making sure that we're building and maintaining our infrastructure every which way that we connect with each other and markets. And also focused on making sure that we're cultivating this pro-growth economy that we have in Indiana. I'll do the same over the next 4 years and also address any issues that may come our way, think COVID-19, et cetera. I look forward to having this discussion tonight.
Next, we will hear from Mr. Rainwater. You have 1 minute.
Thank you, and good evening. In the preamble to the Declaration of Independence, Thomas Jefferson said that to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. Last Tuesday night, Governor Holcomb made it clear that he believes his power comes from the infinite wisdom of the General Assembly and not the people of the state of Indiana. I, on the other hand, side with Thomas Jefferson. I believe that you, the citizens of the state of Indiana, empower government and not the other way around. And I ask you to join me in doing just that, bringing the power of government back to the citizens of Indiana. Thank you.
And finally, we will hear from Dr. Myers. You have 1 minute.
Good evening, everyone, and thanks again to the Debate Commission and WFYI for their extraordinary effort in setting these debates up. If you were listening a week ago, I told you that my name is Dr. Woody Myers. I'm a physician. I'm the former Indiana State Health Commissioner. I'm a father and I'm a grandfather. And if you were listening a week ago, you heard us discuss COVID-19 in some detail. We have spent 1 week apart from each other, but the COVID virus has not been silent at all. We've had almost 16,000 new cases in the last week. The positivity rate has gone from 13 to 23%, and 152 Hoosiers have died just in the last week. We now have about 1,700 people in the hospital in the state, virtually a new record. There's a lot more to do, and right now we're not getting the response that we need from state government to get it done.
Thank you, candidates. Now we will go to the first question. A voter from Muncie asks, many Hoosiers who have to rely on government assistance do not want to be reliant on the state. In my area, a great majority of our employers who provided an actual living wage for people with or without college degrees have shut down. The remaining jobs do not come with wages that will support families without assistance. For those of us who cannot move to where the jobs are located, how will you help to build our local economy so that we can break free of government assistance programs? The first question goes to Governor Holcomb.
That's a terrific question, and one that we wake up every day getting at. That is making sure that, again, our state economic system is growing, that ecosystem, and making sure that the jobs are everywhere. I mentioned last week that there were 109,817 to be exact on today, jobs throughout the state of Indiana. There are 26,000 new jobs coming at an average wage of $27 plus. The key is for us to skill up Hoosiers. That's the importance of having Ivy Tech. That's the importance of having Vincennes University. That's the importance of having Work Ones all over the state of Indiana to connect with you. Our goal is to move more have-nots currently into the have category by economically empowering them. This is how you get to social upward mobility. And so the jobs are there. The jobs are coming. The key for the next decade is to skill up our workforce, and it is close.
Thank you. Mr. Rainwater.
Thank you. We first have to realize that many of the folks that were mentioned in the context of that question are unemployed because the governor shut down the economy. And one of the first things that we can do is make the pledge that as governor of the state of Indiana, I will never again say some Hoosiers are essential, some are not. Some jobs are essential, some are not. What we need to do is reinvigorate the small business community and the family farms in Indiana to ensure that Hoosier jobs are created by Hoosier businesses and that those jobs are allowed to stay open even in a crisis. Thank you.
Thank you. Next, Dr. Myers.
You know, in Indiana, we had lost about 5,300 manufacturing jobs by January of this year because of the trade policies enacted by our president. Since February, Indiana has lost 34,000 manufacturing jobs, only 60% of which have come back. The expectation is about 40% or 14,000 are not going to come back. Some of those were in Muncie, as from the home of the person asking the question this evening. We've got to do a lot more in education. We've got to do a lot more in economic development. We've got to bring a new breed of 21st century companies to the state of Indiana and not depend on the old approaches that just aren't working anymore. And that's what we're going to do in a Myers-Lawson administration.
Thank you. We have a rebuttal from Governor Holcomb.
Yes, back when we hunkered down for about a month in April, we have bounced back. Again, I just mentioned the 26,000 jobs that have come in this year, $4.9 billion in CapEx. Indiana remains the #1 manufacturing in the country per capita. We, since 2009, are #2 in the country for manufacturing jobs coming, about 75,000 of them. We have to be future-proof. That means if technology displaces you, we need to skill you up, and we have the resources close to you.
Thank you, Governor Holcomb. And a rebuttal from Mr. Rainwater.
Thank you. You need to ask yourself as a Hoosier, am I getting better economically? is what the governor is talking about, helping me personally and my family. He talks about skilling up. What he's really talking about is a very Bernie Sanders-esque style of college for all, paid for by the state. And I don't think that's the answer.
Thank you. And our final rebuttal for this question comes from Dr. Myers.
You know, Indiana's behind in a lot of different ways, including income. Our incomes in our state just haven't kept up, and that's because the policies of Republican governors over the last 16 years haven't worked. We've got to change that. Indiana needs a change at all levels, and the State House is the #1 target.
Thank you. And our second question tonight comes from a voter in Kendallville. This voter wrote, "Good, affordable, and reliable internet is still a problem in our rural area. I'm starting a business at my home next year, and having unreliable internet is a big concern." Other voters wrote in to bring up unreliable broadband connection that is making it difficult for students who are learning at home and for senior citizens who are trying to stay connected with family, order groceries, and receive services. How will you help expand reliable broadband internet to all Hoosiers? Mr. Rainwater, you're first.
What we need to do is deregulate the broadband industry in Indiana, which will allow new, innovative businesses and technologies to come in and provide the types of broadband in rural areas that currently they're not able to do because they can't compete with the government manipulated monopolies that are here in the state of Indiana. So through less government, we can actually create a scenario whereby we get better competition and better technologies, more innovation, and actually give people the types of services that they need in the private industry market instead of pushing that with government funding. Thank you.
Thank you. Dr. Myers?
68% of small companies in Indiana tell us that they don't have sufficient internet. 80,000 Hoosiers, kids in our state, about 70 to 80,000 don't have the internet they need in order to do their schoolwork. And about 1 in 5 families doesn't have broadband in our state or good access to it. The programs that we've put in place so far just aren't working. We've got to change our approach. A $100 million grant program isn't the answer. What the answer is to treat the internet as a utility. It's no longer a luxury for someone to have internet. It's not just for watching your favorite show. It's for paying your bills. It's for getting your health care. It's for paying your taxes. It's for getting your job done if you're a remote worker. Our approach to broadband in this state has failed, and it's time for us to do much, much better than we have.
Thank you. And finally, Governor Holcomb.
You know, we didn't wait on this problem, and it didn't take COVID-19 to wake us up. We sought a program that is investing the biggest cash infusion into a state program to connect people with high-speed, affordable internet for telehealth reasons, for teleeducation, for telecommuting. We were doing that before COVID-19. We're also partnering with the corporate sector to make sure that we get out to, Indiana's about 83, 84% still farm or forest terrain. Rocky terrain, expensive terrain. We can expand that playing field by partnering with the corporate sector, and we've already done 79 million, and that's brought in another 70+ million. We've got about another 20 million to go in the third round. That's in addition to the 61 million that we took and invested with and listened to schools, quite frankly, and said, do you need devices? Do you need training? Do the teachers need it? Do the kids need it? And we infused that $61 million into right before COVID-19, or as COVID-19 was washing upon our shore.
Thank you, Governor Holcomb. We have a rebuttal from Mr. Rainwater.
Thank you. Hoosiers, what you're hearing are big government solutions that involve big government programs and more of your tax dollars taken out of your pocket where you decide how they're spent and put into the pocket of corporations so that they can get richer while you still continue to struggle. That's all these programs are. Thank you.
Thank you. Dr. Myers?
You know, I wouldn't describe it as partnering with the companies. I would describe it more as protecting the companies. The $100 million grant program has a lot of restrictions around it, such that if a big company is signed up for your area, and even though you don't have access to internet services, that grant program doesn't apply. It's time for us to put real competition into providing broadband services and let communities have more options of getting their internet, not fewer.
Thank you. And Governor Holcomb?
Yeah, I would just be clear that we heard Hoosiers. They said they wanted us to find a way to make sure that we could expand the playing field and connect students so they don't have to do their homework in a fast food restaurant or drive back to the school parking lot at 9 or 10 p.m. to do their homework. That was unsatisfactory. We went out and creatively found a way to pull in the private sector and speed up that development and connectivity.
Thank you. We're moving to our third question. Many voters wanted to know your position on decriminalization or legalization of marijuana. A voter from Shelbyville noted there are currently 33 states in the U.S. that have legalized marijuana for medical use, and 11 have fully legalized marijuana. Should marijuana be decriminalized or legalized in the state of Indiana? What is your position on the legalization of medical marijuana in our state? This question goes first to Dr. Myers.
Thank you. My position on this has been very clear from the beginning. It is time to decriminalize simple possession of cannabis in the state of Indiana. It makes no sense to be on the border between Indiana and Illinois and walk across the border and become a criminal. It's also time for us to legalize medical marijuana in Indiana. That's going to be a big step for our state, but it's an important one that it's now time to take. You know, I've read the literature carefully, and I know for a fact that there are conditions that respond to the cannabinoids, which include CBD and THC. And it's time to allow Indiana physicians to be able to prescribe those substances for their patients. It's also time to make sure that our veterans are getting the substances that they need, the THC that they need in order to treat PTSD and some of the other complications that they've suffered as a result of their service to our nation. It's time for Indiana to change.
Thank you. Governor Holcomb?
Yes, thank you. I have been very clear and consistent from the very outset in 2017 when this issue first came up. I mentioned that I've taken a couple oaths in my lifetime, one when I was in the United States Navy and another when I was sworn into this office. I don't have the luxury of picking and choosing which laws to legalize at the state level while they are illegal at the federal level. To deal with this, though, I said I will directly write to the federal government. I did, and offered, we've got one of the best ag school in the country, and we got the best medical school in the country, Purdue and Indiana University. We wrote to the FDA, we wrote to the CDC, and we said, let's do some medical research on this. That's the focus group that you want to, just like any other controlled substance or drug that needs to be approved. In the meantime, there are alternatives to those who are in pain. I'm not against researching this medically, but it needs to be done before we can respond in an intelligent way.
Thank you. And Mr. Rainwater?
Thank you. I am for the complete deregulation and legalization of all forms of cannabis. First of all, let me make one thing really, really clear. What you've heard from the other two candidates in a nutshell is we want to reward Big Pharma with medical marijuana and keep it from the citizens of Indiana. And that's wrong. It's plain wrong. We have an economic crisis in our state, and we have the ability to create new agricultural, manufacturing, and retail opportunities for Hoosier business owners just by legalizing and decriminalizing cannabis. And any other discussion about needing to research something that's been around for decades is just misinformation and frankly, should be insulting to every Hoosier. Thank you.
Thank you. We have a rebuttal from Dr. Myers.
Yes, you do. 34 states have already done the research, Governor. They've looked at it very carefully, and they've come to the same conclusion that I have. It's time for a change, including our next-door neighbors, Michigan, Illinois, and Ohio. So I'm sure they'll let us take a look at their research if we need to. I also believe that it would be good for our farmers in the state of Indiana. The facts are that hemp and corn are grow very well in the same kind of terrain, the same kind of soil. So it'll be a boon to our agricultural community as well. So it's a win-win, as well as the tax dollars that'll come from it.
Thank you. And a rebuttal from Governor Holcomb.
Yeah, I'm very suspect about looking to legalize controlled substances for revenue reasons. This needs to be medically researched, and it has not been. I don't do things just because 34 other states have looked the other way and said we don't need federal approval. We'll break the law. In essence, this is a cash business. You can't have bank accounts. Look, hemp is legal in the state of Indiana. It went through the right process. That's exactly the same process any controlled substance needs to go through. We have a responsibility to make sure it does.
Thank you. And our final response on this answer comes to us from Mr. Rainwater.
Thank you. Let's be clear about something. The 9th and 10th Amendments to the Constitution of the United States says that anything that is not specifically allocated as an authority to the federal government falls to the states and the people. And it is the governor of the state of Indiana's responsibility to grab the 9th and 10th Amendments and tell the federal government when they are overreaching. And I believe that this is one of those times. Thank you.
Thank you. So moving to our fourth question tonight, it's on vaccines. Democrats, Republicans, and Libertarians and Independents all want to know your policy on vaccines. Should a COVID vaccine be mandated once it's available? And what, if any, exceptions should be allowed for this and other medically recommended vaccines? This question goes first to Governor Holcomb.
Well, it shouldn't be mandated, but it should be encouraged when it's safe. And it will have to go through the proper approval from the federal government. And we look forward to working with them, and I'm encouraged by things that I read about therapeutics and vaccines that could roll out in the near term. We want to make sure that we're ready to rock and roll when it does come to Indiana, getting it out to the front line, getting it out to the most vulnerable, getting it out to our schools and long-term care centers, et cetera. That's the task force that we've put together already to make sure that we can get it out as quickly as possible, therapeutics as well.
Thank you, Governor. Next, we go to Mr. Rainwater.
Thank you. I am absolutely opposed to mandating vaccines, masks, business closures, the closures of churches in violation of the First Amendment, or any other government mandate that decides whether or not someone is put at risk. And a vaccine, even if it's been tested to be safe, will have possible side effects and risks, just like most other medicines do. And it must be a citizen's responsibility to determine what level of risk they're willing to take, what level of risk they are willing to put their children under, and government should not be involved in that decision. Thank you.
Thank you. And finally, Dr. Myers.
You know, vaccines overall are some of the most cost-effective and important investments that we've made as a society, and they have just proven to be lifesavers over 100 years. We know that there today is no safe and effective vaccine approved for COVID-19, but I'm hopeful that when a Biden-Harris administration takes office and we have a new CDC and FDA director, that one will be forthcoming. I know that they'll look at the research and they'll follow the recommendations of the manufacturers and carefully look at any restrictions so that there may be some patients for whom the vaccine is inappropriate and therefore wouldn't be recommended. So we don't know the full side effect profiles yet. We don't know all of those restrictions, but they're going to be coming. And with respect to distribution, the National Academy of Sciences has already issued a report, which I have read, on how vaccines should be distributed, who to prioritize, healthcare workers, those with pre-existing conditions. And in Indiana nursing homes, that's where we're going to have the supply go to first, because that's where the most risk will be.
Thank you. And we have a rebuttal from Governor Holcomb.
Yeah, I just want to put a shout out. We're fortunate to live in a state like Indiana where we have companies like Eli Lilly who are working on therapeutics, companies like Roche who are working on this very issue, making sure that we have the testing capability in a state like Indiana that has so many long-term care centers, about 535 that we're focused on, and very proud of the hospital network that we have border to border, east to west, north to south, who have all come together and are ready for, including the Indiana National Guard, to deploy vaccines.
Thank you. Moving to our fifth question. Indiana's infant mortality rate has fallen for 3 consecutive years. However, our state consistently ranks highest in the nation for infant mortality. The State Department of Health released data earlier this month that shows that the infant mortality rate fell from 6.8 per live birth in 2018 to 6.5 in 2019, with the mortality rate among Black babies falling from 13% to 11%. How will your administration continue Indiana's gradual decrease in infant mortality? What initiatives would you continue or institute to improve infant and maternal health? This question first goes to Rainwater.
Thank you. We need to realize that many of these issues are inextricably tied to poverty and to economic issues that we can fix by opening up Indiana by reducing the regulations that make it harder for people in certain areas to be able to get good jobs or to go out and get the type of economic opportunity that others get. And this is something that we need to work on by deregulating things, making things easier for small business owners to create the kind of businesses that will give folks the types of jobs that they need to pay for the type of health care that will bring that rate down. Thank you.
Thank you. Dr. Myers?
You know, there have been recent improvements, and that's good with respect to infant mortality, but it takes us from being the 7th worst state in the United States to the 15th worst state in the United States, and we're still the 3rd worst state in the United States when it comes to maternal mortality. There are 33 counties in Indiana out of our 92 that are considered maternity deserts because they don't have the services that pregnant women need. And one of the reasons why we aren't making the progress that we need to make is because we fund our public health infrastructure per capita at a level of 48th in the nation, 48th worst in the nation. All of that has to change. You know, Senator Gene Breaux and others in the legislature have had legislation now for years that have addressed this issue, but our legislature hasn't passed it. Our governor hasn't therefore signed it. I just know that we can do a much better job for the mothers and the babies. This is 2020. It's time for us to just get off the dime and get this fixed. Other states have succeeded. Why not Indiana?
Thank you. Governor Holcomb?
Well, this is where the hard work begins. This is something I was passionate about, that I stood up at a State of the State address and said, we're gonna bring this trajectory down. I don't care how big of a challenge it is. And we did that by first listening to what was happening on the ground closest to the people. We didn't say we're gonna just look at these statistics or numbers. These are people. And what we did is we started instituting programs and policies that actually are working to the tune of the lowest since recorded history, that's 1900, on this front. We're moving in the right direction because of OB navigators. We're moving in the right direction because we're getting mothers, expecting mothers, and mothers who have delivered to the right level of care, the right hospital to get the right care. We're there before the birth and we're there long after. This has to do with much more than just citing a statistic, but the important thing is we are moving in the right direction. In every demographic, Black babies are no longer twice the rate of the counterparts.
Thank you. Dr. Myers with the rebuttal.
Yes, you know, there was a commission that was appointed by the state to look into detail at maternal mortality. They had a great report. I read it. But the legislature didn't pass the legislation. The governor didn't push that legislation. It didn't get signed. And therefore, those recommendations are sitting in the report. I repeat, it's time for us to treat this as the urgent, emergent issue that it is, because we are having our mothers and our children dying unnecessarily, and that's just not right.
Thank you. Mr. Rainwater, rebuttal.
Thank you. I don't know about you, but I don't need government there when my children are born. I don't want government there when my children are born. And I think what we're hearing from both sides is more big government, where government is going to take care of the health care of expectant mothers. I don't hear anything about how we allow people to stand up and take care of themselves. And that concerns me, and I believe it should concern you. Thank you.
Thank you. Governor Holcomb?
Well, it's too early to celebrate, but I am glad that we are moving in the right direction in 2020. This is not 1980 numbers. This is not 1990 numbers. This is not the 2000. This is 2020, and we're going to be in a better position in 2024 than we are now. And that's because we are compassionate, and that's because we are working with all of those stakeholders all over the state of Indiana. Yes, in certain zip codes, but all over the state as we expand. And we're going to together save lives because of it.
Thank you. Our next question. The pandemic and resulting stay-at-home order has brought renewed concern for children living in unsafe conditions. A social worker in our state asked this question. DCS is struggling. There is high turnover, double and legal caseloads in some counties, poor paid foster parents, low parent recruitment, and the list goes on. How do the candidates plan to reform or help DCS? The first question goes to Dr. Myers.
DCS has had lots of troubles. We know that Indiana ranks second in the child abuse statistics, kids that have been diagnosed as having child abuse. We know that we rank fifth in deaths. We know that the previous head of the agency resigned in disgust because she couldn't get the support that she needed. We know that there are also some very dedicated people working in FSSA and DCS, but they're not getting the support that they need. They need a new computer system. They've needed that for years. It hasn't been properly replaced and maintained. We know that there are not enough caseworkers to manage the cases that exist today. And we know that this is in part fueled by the inadequate response of our state to the opioid crisis. We still have people who are taking opiates, even though today's health issue is primarily COVID-19. And as a result, kids aren't being treated properly and are being neglected and abused.
Thank you. Governor Holcomb?
Yeah, this is, I want to publicly salute Terry Stigdon. She has ushered in a culture change at the Department of Child Services, and the numbers prove that it is working. This is another area where we are moving absolutely in the right direction. Actually, turnover, staff turnover, front lines included, is down. We've added employees to the tune of about 600 to meet the needs of Hoosiers. And I can tell you, you mentioned, Nadia, adoptions. Indiana, within the last month, was just recognized as the #1 state in America for foster kids getting connected with their permanent homes. That truly is something to celebrate. Now we got to go find another 1,000 homes for the kids that are in foster care right now.
Thank you. Mr. Rainwater.
Thank you. Unfortunately, the problems with DCS are multifaceted. And those problems didn't start recently. Governor Holcomb brought a consulting company in from Georgia because he couldn't find anybody in Indiana that he thought was qualified to recommend how to fix DCS, spent a large sum of taxpayer money on that consulting gig, and then we turn around, and if you talk to anybody who is a foster parent or trying to adopt today in Indiana, they will tell you that the problems persist, that all they did was throw taxpayer dollars out, and it didn't fix anything. We need to hold people accountable and make sure that we put the children first, not paying consulting companies and vendors first. Thank you.
Thank you. We have a rebuttal from Dr. Myers.
Yeah, so I'm glad that that we're finding more individuals who are willing to adopt. That's good. But the goal should be to make adoption less necessary by taking care of the problems at the time when they can be prevented and not go to that stage. We can do a lot more to help families that are struggling in our state if we try. And in a Myers-Lawson administration, we'll get it done.
Thank you. We have a rebuttal from Governor Holcomb.
Yeah, I just want to say to all those frontline DCS workers out in the field, you are doing the Lord's work, and you are appreciated, and you are helping turn that agency around, one family at a time. I appreciate it, and I appreciate the way that you all consumed that report, that looked under the hood, that kicked the tires, a credible organization, one that everyone could look to and understand their recommendations were experienced and learned. And we have put those into practice.
Thank you. Our next question comes from a self-employed business owner from Brazil who's concerned about the policy and procedures for processing rape kits, noting that there are almost 5,000 untested rape kits in the state of Indiana. Are these untested kits a problem? And if so, what will you do to clear that backlog and to provide local law enforcement officers and prosecutors with the necessary tools to support sexual assault survivors? The first question goes to Governor Holcomb.
Yeah, this is another one of those issues that you can wish it never occurred, but it does. And our Indiana State Police en masse has been addressing this over the years. Before I got here as well. And we'll continue to partner with those local agencies in all 92 counties as we process and as we get to the bottom of each and every one of these cases so that it is done efficiently as well as accurately.
Thank you. Mr. Rainwater?
Thank you. The idea that these rape kits have not been tested and still exist is unconscionable. There's no excuse for it. The state of Indiana has plenty of time and money and resources to do trips to China, for example, but we don't have the resources to process rape kits. That should not stand for any citizen in the state of Indiana. That needs to be fixed immediately. And as governor, I will ensure that we put processes in place to change that. It should not be something that's been around for years, as the governor says. It should have been something that was taken care of immediately, and I will do it.
Thank you. And Dr. Myers?
Republican leaders of this state have had 16 years to make this problem go away. If this problem had been properly addressed, there wouldn't have been a question tonight about it. Clearly, we have a problem with making sure that the priorities are straight with respect to the dollars that we're spending in law enforcement in this particular area. And I'm sure that with the proper cooperation of the state police and local agencies and the proper application of funding, we can get the number down to zero. And in the Myers-Lawson administration, that will be the priority. In fact, it would be a good idea to keep tabs on this. And in the Myers-Lawson administration, we'll publish the number of unprocessed kits on a regular basis just to make sure that we're kept to our word.
Thank you. Our next question, I'm sorry, Governor Holcomb. Do you have a rebuttal? Do you have a rebuttal, Governor Holcomb? Okay. We may be having some technical difficulties. Candidates, please respond if you can hear me.
I just figured somebody didn't like my answer.
Candidates? Okay, we're working on this. Stay where you are, we're working on this. Thank you for staying with us. We are ready to come back. Our next question is on the topic of racial justice. Racial justice has reemerged as a political topic, particularly after George Floyd's death this summer in Minnesota. What is the role of government to address and eliminate racial disparities? This question first goes to Mr. Rainwater.
Thank you. We can start by decriminalizing cannabis and getting people out of jail and out of prison who are simply there because they possessed a plant. We can also start being more aware of the disparities in regulations and laws that adversely affect minorities and minority opportunities. And most of these things, again, are government related, because when government oversteps its bounds, it usually does so in a way that adversely affects the minority community. And we can fix that by having a governor who is actually working on that himself. Thank you.
Thank you. We'll turn now to Dr. Myers.
This is a big issue. We saw the demonstrations, the vast majority of them peaceful, this summer as a result of the George Floyd murder. We know that we need criminal justice reform. We need body cams and dashboard cams in every vehicle. We need that footage uploaded to the cloud. We need bias training for all of our officers as a routine part of their training. We need oversight of that very small percentage of officers that don't follow policy, where accusations have been made. You know, the vast majority of our officers do exactly as they're supposed to, and they know that this small percentage is hurting the reputations of the profession. And yes, we do need decriminalization for simple possession. And we need to make sure that we legalize medical marijuana in the state and apply our laws fairly and equally. We know today that African Americans and Caucasians use substances at about the same rate, but we don't get arrested at the same rate. We get arrested 3 and 4 times as much.
Thank you. Governor Holcomb?
Yeah, let me just say very quickly that on a previous question concerning international trips, those aren't taxpayer funded. That comes out of a foundation and private sector dollars. And the good news is we have tripled our foreign direct investment in the state of Indiana. That's called onshoring. On this topic that was just raised, we are bringing in a third party to do a review of every agency. Simultaneously, after the election, I will appoint the first ever cabinet level chief officer of inclusion and opportunity and equity, the CEIOO. That's a mouthful. But they will be in charge of making sure that we remove any barriers, that we remove any hurdles, and address those gaps. Economic empowerment will go a long way, but we need to be looking at housing, transportation, health outcomes, all the above, including our training, the ILEA, the way that we train our officers, and we will have body cams come next year.
Thank you. We have a rebuttal from Mr. Rainwater.
Thank you. The governor of the state of Indiana should be personally responsible for making sure that state government is inclusive and is not derisive. He should not be hiring a commission to come in, spending your tax dollars. He should not be adding bigger government, a new cabinet position, somebody else who can do part of his job for him so that he doesn't have to do it. He should be doing that himself. Thank you.
Thank you. We have a rebuttal from Dr. Myers.
Yes, I don't want the state to hire a CEIOO. I'm going to make sure that all of my agency heads have this at the top of their agenda from day one, in addition to accomplishing the goals for their agency. You know, perhaps my opponent needs someone to help him understand the issues of fairness and equity. I've lived in this state for many years. I've been under siege on occasion because of race. I understand what fairness and equity is all about, and it'll be a priority for my administration to make sure that we have all of the fairness and equity that the state can get.
Thank you. We have a rebuttal from Governor Holcomb.
Yeah, I just think it's important to note also that it is a team effort. And that's the way we approached every tough issue over the last 4 years. And it will be the same collaborative, consensus-building effort come the next 4 years if I'm here. And that means we're going to have to continue to work with county prosecutors. It means we're going to have to continue to work with county sheriffs. It means we're going to have to continue to work with the General Assembly. We'll lead it for the executive branch, and we've made a lot of progress. I just want the state of Indiana to be a model for 49 others to look at.
Thank you. Our next question is about gerrymandering. The boundaries of our state legislative and congressional districts will be redrawn in 2021 based on the 2020 census. A number of groups support having a nonpartisan commission draw the districts. Some also support prohibiting use of election results and primary election voting records when drawing the districts. Do you support either of these ideas? And what factors do you think should guide decisions about where to draw district lines? The question will first go to Dr. Myers.
Yes, I do support having a nonpartisan commission to redraw the lines after the results of the 2020 census are in place. I've looked at the maps for the Indiana General Assembly and for our congressional districts, and the only word I can think of to use to describe them is bizarre. And of course, they are all appropriately created to preserve districts for individuals or to maximize a particular party's vote, and that's just wrong. We know that the Supreme Court has come out and said that that's not the appropriate approach. Other states have decided it's not the appropriate approach. It's time for Indiana to become a member of this part of the 20th century and to do the right thing, and that's to create an opportunity for fairness in the drawing of district lines and to let a nonpartisan entity have at it and make sure that they're doing it on the basis of natural borders of like areas and to do it right.
Thank you. Governor Holcomb?
Well, our districts have been looked at by the courts, and then they have withstood that scrutiny because we have kept communities intact. And I would just say that when you're looking for a nonpartisan individual, easier said than done. Folks have different backgrounds, folks have different futures, and it's easy to say, well, go find someone who's not politically active, but folks, that's kind of in the eye of the beholder. So we live in a democratic republic. We elect representatives, our senators and our representatives. It's charged to them. The people put them there to make these decisions, and they have withstood, again, legal scrutiny. People decide where they're living, not the other way around, and these districts are drawn around, and by the way, they are very intact.
Thank you. Mr. Rainwater?
Thank you. What the governor seems to have forgotten is that in Indiana, everything is Republican and Democrat. The Indiana election division is run by a Republican and a Democrat, bipartisan. But there is actually a Libertarian Party out here that is always left out of everything other than the debate commission, who is neither Republican nor Democrat and would be neutral in the drawing of districts. So it is possible to find people who do not lean either to the Republican side or the Democrat side, who would be able to sit down and, in a nonpartisan way, do just that. Thank you.
Thank you. We have a rebuttal from Dr. Myers.
Yes, just as we were able to find nonpartisan moderators for this debate, we can find nonpartisan individuals, and it's not just one individual. The question was, could we have a commission? We can find nonpartisan individuals that represent the entire spectrum of political thought in our state, and those individuals, if given the proper task, could come up with, I think, an exceptionally fair way of thinking this through. And yes, we know that it should be done, it can be done, and it must be done.
Thank you. Governor Holcomb for a rebuttal.
Yeah, technology has helped us tremendously over the years keep communities intact, and that's exactly what's happened. It was just referenced that members of a party would be nonpartisan. That, by definition, is just inaccurate.
Thank you. Rainwater with a rebuttal.
Yes, thank you. I do want to point out that both Dr. Myers and I are for this, but the candidate who is the member of the party with the supermajority is against it, which tells you where the problem might be. Thank you.
Thank you. Voters across party lines from Austin, Brazil, Edinburgh, to Roanoke, Seymour, and Warsaw all had the same question. You have 30 seconds to share your position on daylight saving time. Should we change our clocks? Should we standardize the state? What time zone should we choose? You have 30 seconds. This will first go to Governor Holcomb.
Yeah, I think this has been settled. I had no gray hair before we did. The first go around, we sent the word out to the world that we were going to recognize the Eastern time zone. I'm good with that. We need consistency and predictability and stability and not rehashing.
Thank you. Mr. Rainwater.
Thank you. It doesn't matter whether I'm good with it or not. What matters is whether the citizens of the state of Indiana benefit or find detriment in the way things are today. And so, as governor of the state of Indiana, I would look very closely and very carefully at all of the data and all of the facts to figure out how to make sure that the maximum number of citizens are in a situation that benefit them. Thank you.
Thank you. Dr. Myers.
You know, I'm old enough to remember the days when in Indiana you never had to change your clocks and everybody else was always off. I kind of look back at those with some fondness, but this is an issue that is one where you're never going to make everybody happy. I can make arguments on both sides of it. I think it is appropriate to relook at the data, to relook at the opinions of Hoosiers, but I don't see an immediate need for that to evolve to the top of the agenda.
Thank you. We have a rebuttal from Governor Holcomb.
You know, just been there, done that. And I would say that this issue and interest is borne out at the county level. It will take legislative leadership and a gubernatorial leadership if we were to address this in terms of the state. It comes to your desk ultimately.
Thank you. We have a rebuttal from Mr. Rainwater.
Yes, just briefly. Fellow Hoosiers, this is something that many people have asked me about, many show concern, and you see that your incumbent governor's attitude is been there, done that. Thank you.
So now it's time for our final question this evening. For this final question, each candidate has around 30 seconds to respond. The question is this: what do you believe is the biggest issue affecting Hoosiers' lives today? And how does your platform plan to address this issue? Mr. Rainwater, you will be answering this question first. You have 30 seconds.
Thank you. I believe that the biggest issue today is, are you experiencing government by your consent? And are you better off today than you were 4 years ago? That's the bottom line, folks. We as Hoosiers have to decide, are we happy with big government or do we want our individual freedoms back? Under a Rainwater administration, we will bring Hoosiers' freedoms back. Thank you.
Thank you. Dr. Myers, you have 30 seconds.
As governor, my number one issue will always be public safety, period. And under that umbrella, we'll have public health, criminal justice reform, those things that keep Hoosiers safe. I make no apology for that either. I'm a physician. I'm a former state health commissioner. I understand the connection between the economy, between the environment and health care, and we can make them all work together synergistically in this state if we change the governor's office leadership in this state. We've had 16 years of failed Republican leadership. It's time for a change.
Thank you. Governor Holcomb, you have 30 seconds.
I said in the Hoosier Gym in Knightstown, Indiana, last year when we set sail on this re-election endeavor that we were going to run a different kind of campaign. It was going to be all positive all the time, solution-oriented. We've done just that, based on a foundation of civility. The biggest issue, I think, facing the state of Indiana and every other state in the nation is how we are able to skill up our workforce. The scale and pace of change due to technology is faster than it's ever been. I look forward to another 4 years, and we'll work hard to earn your vote.
Candidates, on behalf of the Indiana Debate Commission, thank you for participating in tonight's debate. The Commission is a nonprofit organization that depends on many affiliates to make these events possible. Those include WFYI, which produced and hosted the debates this year, and our major sponsors, AARP Indiana and the Indiana Broadcasters Association. Finally, thanks to all of you and our audience of voters for submitting questions and for watching or listening. Now it's time to make your voice heard in the voting booth. For the Indiana Debate Commission, I'm Nadia Brown. Good night.